I'm Dr. Nick Circleon. I am so excited to be with you as always. Today, our show is going to be centered around low back pain. Not just any low back pain. We're going to be talking about a specific low back pain called Facet Syndrome. We have here a small spine, 5 cervical vertebrae, 1, 2, 3, 4, 5. The facet is this structure right back here. It's the joint that's superior and the joint that's inferior that causes or creates what's known as the facet. We have this inferior and then we have the superior. These combined together are called the facet joint. The facet joint also creates what's known as the foramen, or that area where a nerve exits. Also, you have an artery that exits there, a vein that exits there, you have lymph tissue that exits there, and you also have adipose tissue in that area, or fat tissue. Also, we have the disc. Now, the disc, the nerve, the ligaments, the tendons, they're soft tissue. The joint itself, the facet joint, is bone. So we're going to be talking about the difference between radicular pain caused by facets and radicular pain caused by the soft tissue. They both have a radicular component. A radicular component means it's where it radiates down into the extremity. With Facet Syndrome and with disc pain, the radiation is very different, and we'll talk more about that as we go along. We have a disc, we have the bone, we have the facets, then we have our nerves. Inside, that goes straight down, is the spinal cord. A disc can affect the spinal cord, whereas a facet does not. A facet can affect the foramen, and so can a disc. A disc can affect left and right, where a facet is usually one-sided. Even though we have 2 facets, generally we'll have one side or the other. That doesn't necessarily mean it won't be on both sides. It can be. But where a disc can slide from left to right, a facet, either it's left or it's right. It's never both of them causing the same type of symptoms. So let's talk about symptoms. Let's talk about the soft tissue symptoms of a disc first. When a disc is pressing on a nerve, you're going to get pain that radiates down into the leg. Now, I know people are watching and go, that doesn't always happen that way. It's correct. Not always do we have a radicular pain caused by either the disc or the facet. I'm giving you the most common type of symptoms. So what happens is we get pain that shoots down into the foot. Depending on what disc is involved, usually depends on how far down the leg it goes, but it will always go past the knee, and how far into the foot it goes. Whereas a facet, the radicular pain rarely goes past the knee. Not saying it doesn't, but rarely it goes past the knee. Not saying a disc couldn't go past the knee and could not stop at the knee. That's not what I'm saying. What I'm saying is, most of the time the differentiation is a disc will go past the knee, a facet usually stays above the knee. Most disc pain can become irretractable. Doesn't matter what position you're in, doesn't matter if you're sitting, standing, walking, leaning, twisting, doesn't matter. It will keep producing that type of pain, to the point where sometimes that disc will be so inflamed you're going to need some medication to help alleviate the inflammation. A lot of times patients get painkillers for that irretractable pain, where the problem necessarily isn't the pain, it's the inflammation. So if we can get the inflammation down, what happens is we're decreasing the inflammation, the pain will start to go away. And a lot of doctors over the years have realized that giving painkillers for problems like this is not necessarily taking care of the problem. What they're starting to do now is we're giving muscle relaxers and anti-inflammatories such as steroids or a dose pack that really do a better job than giving somebody painkillers and muscle relaxers as we did years ago. With the facets, it's also an inflammatory process. So we can use steroids to help that as well and muscle relaxers. So we can treat it both ways. We can treat a disc with manipulative therapy and we can treat facets with manipulative therapy. We can treat discs with decompression therapy and we can treat facets with decompression therapy. The treatments can be the same, but the outcomes are sometimes different. So let's go into some of the treatments that we would do. We already know we can take muscle relaxers or an anti-inflammatory to help decrease the pain and improve the function. That's for both of them. Manipulative therapy. We can manipulate a disc. Let me rephrase that. We can manipulate the area around that to help release the pressure of the disc on the nerve. And we can open up the facet joints to help decrease the inflammation and decrease the pains caused by the facet. One does work a little faster than the other. I will have to say that. If we have a disc problem, manipulative therapy may need a little bit more to help us get over the hump, such as the muscle relaxers and the anti-inflammatories. It also may take a little bit more time than a facet. With a facet, if we use medications such as an anti-inflammatory and a muscle relaxer and manipulative therapy, they seem to respond a lot quicker. Not saying it doesn't work, it just one takes a little bit longer than the other. It doesn't matter whether it's a facet or whether it's a disc. The problem and the time is the same no matter what treatments we get. Remember, we can do physical therapy, we can do medication, we can do chiropractic, we can do other manipulative therapies, we can do decompression therapy. When we're dealing with a facet, they seem to respond a lot quicker with those therapies. When we're dealing with a disc, it seems to take a longer amount of time. So what we tell patients is, if it is a disc problem, we let them know it's gonna be a little bit of time before we get it taken care of. If it's a facet, we tell patients that it's gonna happen a little bit quicker. Now, I know a lot of you are thinking, how long is this gonna take? It all depends. I cannot give you a solid answer. I'm gonna go off on a little side note here. I personally am not a fan of treatment plans. Now, let me explain what I mean by treatment plans. I'm all for telling patients how long things are gonna take, giving them a full disclosure of what the treatment's going to be and how it's going to work and the pros and the cons. What I'm talking about a treatment plan is telling a patient it's going to take X amount of weeks, X amount of visits, it's going to cost you this much money, and if you pay up front, it's going to be cheaper. That's what I have a hard time with. Not the fact that you're telling the patients this is how long it's going to take, this is what we think it's going to be. In our office, I'm just giving you our office because that's all I can tell you. In our office, when a patient comes in, whether it be a low back pain caused by facet or a low back pain caused by a disc, we tell the patients up front, we're going to try these treatments. If it doesn't work, we're going to the next level and going from that point on. Let me sidetrack just a little bit before we continue this and tell you what we would do with a patient that has facet or disc problems. First thing we're going to do is we're going to do a full exam. If you've been watching my show, you know that I am a certified chiropractic orthopedist. What that means is that I'm basically a non-surgical orthopedist. I don't do surgery and I don't give medications. I try to take care of things more holistically. That doesn't mean that I don't believe in surgery. That doesn't mean I don't believe in medications. What that means is we try to do things more holistically to get the patients back to where they need to be. In my 31 years of practice, we've done extremely well of getting patients better quicker. Come into the office, let's say we have low back pain, we're not sure what it is. Your first visit will include a full battery of exams to see what area that we're dealing with. Is it a facet? Is it a disc? What's causing the problem? It may be something else. There is other areas of the body that can cause low back pain. Your colon could cause low back pain. For women, the female organs can cause low back pain. For men, the male organs can cause low back pain. So we have to rule all of that out to make sure that it's a neuromusculoskeletal condition before we go forward trying to manipulate areas that won't do well to manipulation because it's not a manipulation problem. Once we narrow down that it is a neuromusculoskeletal condition, then what we'll do is we'll gently and conservatively treat the patient that day. That can mean we're using an instrument adjustment, we're doing stretching, we're doing myofascial release, we're doing trigger points. Now, let's say the patient responds well to that. We may give them a second visit and see how that works. But after that second visit, depending on the age of the patient, depending on the mechanism of injury, depending on a lot of other issues, we will then send them out for x-rays. That's right, I do not do x-rays in my office. We send you to an x-ray facility that does the x-rays for me. I'm on a PAC system. What that means is as soon as you get your x-rays, I get to look at those x-rays, we get to go over them. From that point, then we tailor the treatment. So let's say that we've done that treatment over a period of time, maybe a week and a half, and we realize, you know what, this is more of a disc problem than it is a facet problem. At that point, we're going to do an MRI. I will still do an MRI if I think it's facet. I will still do an MRI if I think it's disc. If this patient isn't responding to treatment the way we want them to, on that MRI, we see some things that, they're not so kosher. At that time, we're already have the patient in the pipe to see a medical provider to get medications to help with the pain and help with the inflammation. Sometimes we do that right away. I'm just going to be honest with you. Sometimes a patient will come in, they've had this problem for months, it's been overlooked or been mistreated, and we'll just turn around and we'll make a call, and what we'll do is we'll make sure that they can get some medication so that way we can do what we need to do, and in the interim, we can still send them for x-rays and the MRI. I will tell you this, what I've seen in my career is if somebody goes into their family practitioner, they may get some medication for it, they may get sent for PT before they even get x-rays of it or any kind of imaging. I've actually had patients come in that have had a problem for several weeks and even several months that have not had any imaging, but they've had treatment with medication and they've had physical therapy, but nobody ever looked at the area, which I find to be odd. If it doesn't respond really quickly, I'm not sending you for PT, I'm not doing manipulative therapy. Let's find out what's causing this problem. So how do you know if you have disc pain or if it's a facet? Really easy. If it's not going away, it's usually the disc. If you're having pain shooting down the leg, it's usually the disc. If you have pain in any position, it's usually the disc. Sometimes you can lean away from a disc. If my disc, I'm on the right side, if my disc is on the right and I lean away from it, sometimes that'll take away the pain. Sometimes if I lean forward, that'll take away the pain. If I extend back, sometimes that'll take away the pain. But most of the time, it's really hard to get away from disc-type pain depending on what it's touching. And as I said earlier, it's usually unilaterally, but it can be bilaterally with a disc because of the way the disc's anatomy is. With a facet, it's usually on the one side. If you've had facet pain, as soon as I say this, you'll go, that's exactly what happened to me. If you have facet pain, it's very difficult to get out of a chair. You have to push yourself up. You have to put your hands on your thighs to pull yourself up. And then once you stand up, you stay there for a second and then you start walking, you go, oh, I feel much better now. But if you go to extend, it hurts. If you go to bend slightly forward, like to brush your teeth or wash dishes, it hurts really bad. But if you can get past that flexion and get down, you can touch your toes with no pain. Come up to that one point, it's excruciating pain. Extend, it's excruciating pain. Sometimes if you're in the supermarket, it's easier to hold the buggy. Same thing with a disc though. I have patients that say, I feel so much better if I'm leaning over the buggy. It takes all that pressure off my back. I feel much better. The other thing about Facet syndrome is walking makes it feel better. Sitting doesn't bother it. It's going from a seated to a standing or standing to a seated position. The other thing is, it doesn't radiate past the knee. It's usually one-sided. The other thing that I have patients do, I have them suck their belly in and stand up. And they go, oh, I can't do that, I can't do that. Then I have them push their stomach out like they're straining on the toilet. They push that stomach muscle out, they splint that area, and they stand straight up with no pain. Now this can mean they can have pain for weeks, and we do this one procedure and they stand straight up and they're like, that was amazing. It's because their core is not strong enough and their core is not engaging. And what happens is we have these small muscles on the back end of the spine, and they hold these really tight so the spine can stay splinted and erect without it collapsing. These muscles right here, they're very hard to rehab. There's one exercise that I give patients, I don't care how old they are. is breathing exercises, because they're breathing from their chest and they're not breathing from their abdomen. We want them to breathe from their abdomen, because as soon as they start breathing from their abdomen, these start to splint, the pain starts to go away. I have patients laying in a supine position, means they're laying on their back, and I'll go and I'll ask them to do a sit-up. As soon as it hurts, I have them lay right back down. Most of the time, they come up to about 40 degrees and they have to lay back down. I have them do this breathing exercise 5 times. After the 5th time, I have them sit up, and in a majority of the patients, I would say 80% of them, they get up without having any pain. Remember what I said earlier, there's different modalities that we use and different treatments. With Facet Syndrome, we seem to get better results. And a lot of times, Facet Syndrome is what's causing back pain in our patients. It's called mechanical low back pain. If you've ever had low back pain and you've had treatment, whether it be manipulative therapy, whether it be physical therapy, whether it be medications, whether it be decompression therapy, a lot of times, depending on what it is, if it's a disc, it's going to take longer. Just want to be honest with you. If it's a facet, it's usually shorter. If you have facet pain and you've decided to do decompression therapy, it's usually a quick fix. When I say a quick fix, maybe 12 visits to help get you out of pain. When it's a disc, kind of double that, because it takes that much longer. So when I have patients come in, my favorite thing to say with Facet Syndrome is you have more pain than you do problem, because we can work through this. Let me be really honest with you. If you have Facet Syndrome, it's usually because of degenerative joint disease. If you have degenerative joint disease, I don't care if you take medication, I don't care if you get manipulative therapy, I don't care if you stretch, I don't care if you exercise, this degeneration will not go away. You can slow it down, you can make it feel better, but you're never gonna make it go back to where it was before. Once we have those degenerative changes that's going on in there, we can slow them down, but if we do nothing about this, these start to progress. So when they start to progress, they progress to a certain point, we can slow it down at that point, but we're never gonna get it back to where it was before. This area will always be vulnerable to injury. The good news is though, as soon as it happens, you get to treatment pretty quickly, it goes away. You may only have a few bouts a year, you may have a few bouts every few years. All of that to be said, if you're dealing with low back pain, you need to get it looked at. Don't try to doctor it yourself, have it checked out by a professional. Let that professional give you their professional advice on how to deal with this, rather than chasing your symptoms on the internet or chasing your symptoms from doctor to doctor to doctor to doctor. If you're having a problem and you see a provider, if it's not responding quickly, and when I'm talking quickly, within a week to 2 weeks, if it's not responding, change your treatment. Get a different type of doctor to look at it. If you're going to your family doctor and you're not getting better in 2 weeks and they suggest physical therapy, go to the physical therapy. If they don't suggest a physical therapy, ask, hey, can I go to a physical therapist? Can I go to a chiropractor? Can I go see the orthopedist? Are you going to do any testing? What are you going to do? Because now I've been dealing with this for 2 weeks. Because most patients that are dealing with low back pain for 2 weeks have really been dealing with it a lot longer. They're just suffering with the pain because it hasn't been debilitating. But once it gets debilitating and it's not getting better in 2 weeks, you want to do something different to it. So guys, if you have any questions, please leave those comments down there and I'll answer those questions best I can. I hope you guys have a great week. We'll see you soon.